Yes, good morning again, everybody. My name is Saturini Manangwa, working at the Ministry of Health, Department of Nursing and Midwifery Services as the Assistant Director, focusing on quality improvement of nursing and midwifery services. So I will be taking you through the project, focusing particularly on the work packages and details of activities that are planned to be done throughout the project period. So, however, I will start with a little bit background and why this project is connecting to the health sector wishes and how it will improve the well-being of people. So starting with the overview, we have been actually really having challenges in relation to client experience of care, and we have several evidence and publications that are showing that in some of the health facilities, we have some mistreatment to the patients, and which is bringing to negative impact in terms of client experience of care. So we as a country, actually, we came up with the guideline that is trying to address the challenge. This is respectful and compassionate care, which is referring on how we consider individualized care and considering the patient's needs rather than providing services just in generic manner. So with the connection of universities and our fellow from European Union, we are aiming now to see how the respectful and compassionate care, including health literacy, can be taken into policy, into policy actions, and to improve the healthcare system in our country. So that is why we came up with this project, and as a ministry, of course, we see this project is coming in a good timing. Looking at the main aim of the project and the objectives, basically we want to improve the quality of care to our health system, and this has been addressed by health sector strategic plan measures, which are looking at the quality of care. Especially now we are starting with the strategic plan for 5 years, which is starting this year. One of the main issue which is being emphasized in the plan is quality of care. And when we look at the quality of care, now we have a component of client experience of care, which is crucial, and it is not doing relatively good in our environment. So to accomplish this, we have specific objectives that will be developing training materials that will be integrated to the curriculum. And with this in particular, we are going to focus on university curriculum for students who are taking bachelor degree in nursing. But also, we are going to improve capacity of the university and including teaching hospitals in terms of educators, lecturers, clinical instructors, and the team which is involved in teaching, so that they can integrate and they can be competent in transmitting the competency of RCC and health literacy to students. And again, we are going then to implement during the curriculum implementation in the university to see how it will be affected to the students during teaching process. And this also will improve evaluation mechanism of attitude component during teaching, because one among, if we look at the health literacy and the RCC is more of attitude issues. So we during the curriculum implementation, we are aiming also to look at how we improve evaluation of the students in terms of attitude. How do they take issues of patients and integrate during provision of care? So these are specific objectives. However, before we talk of work packages and the details of the activities, I just want also to highlight with looking at the project connection with the Ministry of Health initiative in improving health services. As I've said, health sector strategic plan is emphasizing on the quality of care. But also we have the initiative of evaluating service provision, which is called the star rating assessment, which we used to do to look at the performance of health services in our health facilities throughout the health system. And one of the major components is looking at the client satisfaction. And actually, if we go back to our data with our assessment, the baseline which we did on 5 years ago, you can find that the performance on this component was not good. Most of the clients were not satisfied with the health services that they are getting. And if you look into details, it's just the issues of communication and how the healthcare workers are handling the patients. So again, now the policy is emphasizing on how we increase the utilization of the health services. Sorry, I'm getting some interference. I think somebody is not muted. Okay, so as I'm saying now, we are moving toward the universal health insurance coverage, and with this we are ambitious to see that we increase utilization of services and the retention of patients into the public health services. Public health services institutions, because experience shows that most of people with the insurance coverage, they tend to go to the private health facilities rather than public health facilities. So we look if we are going to cover health insurance to all people, then probably hypothetically we see that public health institutions will be suffering from having limited number of clients. So with the project, we can see it will increase the utilization, acceptability of our services. On behalf of the ministry, we look this project as an important project in improving quality of care. And customer care, communication skills, ethical practice during provision of care have been crucial in affecting the client experience of care. So with this project, these elements will be taken as main emphasis to ensure that the students coming from our universities are having the mindset of looking at the patient at the individual level, or patient-centered care, considering all these components so that we can improve quality of care. Thank you for listening, and I have to pause here. Thank you.